Hi, I'm Andrea. I am a student nurse and I will be going over some discharge instructions for you and your newborn. First, I'd like to talk about your newborn and congratulations, but also what to expect as far as when your body changes after having your baby. There you will experience bleeding. It should be about the dark color red that it is now. That should last for about 3 days. The bleeding should get lighter and it should get more consistent and slow down on the flow. If you experience any changes where it becomes like a bright red, like fresh blood, I would say, you need to call your health care provider. Let's see. It does look like that you possibly tore, yes. So you will have some stitches. Those do dissolve, but however, you can use warm water and a peri bottle, which is already in your bathroom. You can use that. Always make sure you go from front to back to decrease the chance of any bacteria from your rectum to get in that in your vagina. It is also very beneficial if you use that spray that will help with the pain down there. Also, if you do get any pain medications, just be cautious that they will or can cause constipation, and with that you may use a stool stapler or a stool softener, excuse me. But if you use that too much, then you'll have diarrhea, and we don't want that. So make sure that you're taking your pain medication, using the dermoplast, stool softeners as needed, washing from front to back, making sure there's no additional bleeding, smells, changes. If you saturate a pad, like just your pad, more than 2 in an hour, you need to call your healthcare provider. As we talk about that, your body will let you know if there is any changes and that you might need some rest. You will experience some more bleeding and discharge. It could become heavy again. If it does, then you need to rest. Try to rest and then go from there. There's some things that you should avoid whenever you first get home until you have been cleared. You need to avoid heavy lifting. You shouldn't lift anything more than your infant in a car seat, in the car seat that they have. You should not exercise until you are cleared by your healthcare provider. You should not use the stairs often. You should stay away from swimming pools right now. Also, bathing. You need to shower instead of taking a bath. You do not want to sit in that warm water with soap or anything like that. That could get up into the vagina and cause any kind of infection. You shouldn't drive just due to the nature of your reactions. You should wait about 1 to 2 weeks. If not, if you need to, I would consult with your healthcare provider before operating a vehicle. It is also very important with those pain medications that you are not taking those while you are driving. Let's see. When we talk about your bleeding, your driving, the resting, the avoiding lifting, anything like that, your body is trying to go back to normal. That is something that happens over time, and with that being said, you should not insert anything into the vagina at least for 6 weeks. That means no douching after the flow, no tampons. I know it might be easier than the pads, but we don't want to do that. We don't want to have any kind of sexual intercourse that requires insertion into your vagina while we are healing. It is just beneficial that you stay away from things like that. Okay, let's see. It looks like when you do have a baby, your body again is going back to normal. However, you have a mix of emotions. There is things that we like to refer to as postpartum blues and postpartum depression. Postpartum blues are more like they happen for like a day or two or so. You might feel tired. You might wake up often, not for sure what's going on. You might be stressed. You might have an increased anxiety. And it should resolve. It's not a longing thing. However, postpartum depression is when you have like a decrease in your appetite, your energy, your ability to thrive. You might experience some feelings of hopelessness or extreme sadness, like I can't care for my baby, things like that. It is very important that you get medical attention. It's common, it's normal, it's nothing to be ashamed of, and there's plenty of help that is readily available for patients and new mothers who are trying to get back to normal. So that is something that do not feel like you should not feel that way. It is okay, it's common, it happens. We'll get you through it. Let's see. There's some things that you should know that if you do experience, you need to call your healthcare provider. Of course, if you have a fever of 100.4 or greater, if you have unexplained chills, if you have trouble urinating or it hurts to urinate, if that discharge becomes like foul, if it smells, if it has a strong odor, if you see excessive clots, if it becomes super bright red, if it just changes, and you tried the rest, make sure you notify your healthcare provider. You should not ever feel faint and dizzy. You need to monitor your swelling, of course. You just had a baby. Things are going down. Things are going back to normal. Your legs should not be swollen, super swollen. They should not be warm to the touch. They should not be red. If that is anything that you have noticed, you need to, one, try elevating your legs and see if that helps. Anything above your heart, so like if you're laying down, just make sure your feet are propped up on some pillows, and then if it doesn't go away or goes down, notify your healthcare provider. You will follow up with your doctor in about 6 weeks. Usually they do talk about birth control, so think of those options right now, or not right now exactly, but just in the future, so that way you have a game plan if that's what you choose to do. If not, it's totally your decision. Let's see. Okay, so when it comes to baby, we are going to try to adjust to their schedule while they're trying to adjust to your schedule. It is important to try to have routines set, so that way it saves you some sanity and also saves you a lot of stress. Let's see. You want to breastfeed every 2 to 3 hours. Each side will be, every time you breastfeed, it should be about 10 to 15 minutes to know that your newborn is getting enough milk. You also want to rotate sides. So if you have to, come up with some marker, make sure you have a little chart at your bedside, so you know, because that way that will prevent overproducing in one side, and then you let releasing this milk in one side and not in the other. If you're going to bottle feed, you want to do that every 3 to 4 hours. You want to start off with 1 to 2 ounces, and then gradually get up to 3 to 4 ounces in every feed. Let's see, newborns, they should always have about 7 or fewer in 24 hours. You don't want them to overeat, because their body is trying to get used to this new milk, and mom not feeding them and stuff like that. And so you want to give their little body a little break. They should have about 5 to 6 wet diapers within 24 hours. If that is not something that you see, you should be like 4, but less than that, you should be a little concerned. Stools in infants will change. How often they go will change. You can pretty much expect them to have a stool by the fourth day if you experience or see